Imagine having a medical concern that feels overwhelming, then learning that there are clear paths to overcoming it completely. That feeling of hope is incredibly powerful, especially when it comes to health challenges. When stomach cancer is detected at its earliest stages, specifically stage 1 or even some very early stage 2 cases, the primary goal of treatment is often a complete cure. The most effective treatments for achieving this are surgery, sometimes combined with endoscopic procedures, and occasionally with additional therapy like chemotherapy or radiation therapy, although surgery is typically the cornerstone. The ability to offer a curative treatment largely depends on how far the cancer has spread. In early stomach cancer, the malignant cells are confined to the innermost layers of the stomach wall, meaning they have not yet invaded deeper tissues, nearby lymph nodes, or distant organs. This localized nature is crucial because it allows for the complete removal of all cancerous cells through surgical or endoscopic techniques. Once the cancer has breached these early layers, the risk of recurrence and spread increases significantly, making a complete cure much more challenging. For very early stage 1 stomach cancer, an endoscopic resection might be performed. This minimally invasive procedure uses a thin, flexible tube with a camera to remove the cancerous tissue directly from the stomach lining, avoiding traditional open surgery. However, for most early stage 1 and stage 2 cases, a partial or total gastrectomy is the standard. This involves surgically removing part or all of the stomach, along with nearby lymph nodes, to ensure all cancerous cells are eradicated. Your healthcare team will carefully consider the tumor size, location, and depth of invasion when recommending the best surgical approach. It is important to know that early detection often happens through routine screenings or when symptoms prompt a doctor's visit, highlighting the value of paying attention to your body. For instance, sometimes a procedure like an upper endoscopy for unrelated issues might accidentally discover a very small, early stomach cancer. This unexpected finding can turn into a life-saving opportunity thanks to the effectiveness of early-stage treatments. Understanding your specific cancer's stage, subtype, and molecular profile is also key, as this personalized information guides your doctors in tailoring the most effective curative plan for you. Ultimately, the goal of treatment for early stomach cancer is to remove the cancer entirely and prevent its return, allowing you to live a full and healthy life. Empowering yourself with knowledge and working closely with your medical team to choose the right curative path based on your specific diagnosis is truly invaluable.